Hi, my name is Yannick. I'm one of the nurse injector here at Sparkle Lifestyle Medispa, and I'm here to answer some questions about PRP for hair restorations.
So, what is PRP?
PRP stands for Platelet-Rich Plasma, which is coming from your own blood. And the way we do it is that by taking blood work, we put your blood into this machine that spins it, and then your plasma separates from the red blood and the white blood cells, and we use that plasma to inject into your scalp to stimulate hair growth.
How does the PRP work to stimulate hair growth?
So the PRP, which is your plasma, is full of growth factor and antioxidants and vitamins. So by re-injecting it into the scalp area to promote hair growth, it stimulates those hair follicles that's been dormant for a while. And then as weeks goes by, you start noticing a little growth of baby hair at first before they often get more longer. And you also notice a thickness of the hair as well.
What results can be achieved with PRP treatments for this?
It does take some time for the PRP to fully work and the hair to fully grow, but a typical treatment time would be a series of 3 treatments done every 4 to 6 weeks, and then waiting 3 months to see how the hair is growing. If somebody has a more healthier lifestyle, their blood is very clean, they're usually going to get really good result with one series of 3 treatments. But for example, I have some people that after a series of 3, we would see a little growth, but it was maybe not enough. So we would do another series of 3 treatments to give it a good push so the person can be happy and see the real difference.
Is this a safe treatment?
It is a very safe treatment. PRP, again, is coming from your own blood, so there's no risk of infections or allergic reactions. I would only say that because it is an injections done onto the scalp, for some people it might be very sensitive. So some people I would recommend to maybe take a few Tylenol before their appointment to minimize the pain.
What is it actually like during the treatment?
So during the treatment, you come in, we take your blood, we put it in the machine to spin it, and while the machine is spinning your blood, you're just relaxing. If you're taking Tylenol, that would be the good time to take it right before the treatments. And then during the treatments, we're doing injections to the concerned area. Some people, sometimes it's just along the hairline, but we can inject really everywhere on the scalp. And afterwards, people have to be careful not to apply anything on their hair, not to wear a hat for the next 24 hours. And then we'll recommend to only wash your hair 24 hours afterwards.
Who would not be a good candidate for this treatment?
So people that would not be a good candidate for that treatment would be people who has blood anemia. So if your platelet level is low, you wouldn't be a good candidate for that. If you're on antibiotic or that you have an infection, we would recommend to wait a while before we can proceed to those treatments. And then other people I would recommend to maybe do other type of treatments would be people that are a little bit older, or people who their blood would not be that great because maybe they're on blood thinner for some medical reasons. So at that point we could look at other alternative, for example exosome or microneedling.
Are there some things you can combine with this treatment to help boost the hair growth?
Yes, there's a few things. So even though we're doing the for people who's doing the PRP, you can mix it with microneedling for optimal result. It can also be mixed with another laser that does resurfacing of the scalp, which is called the Nordlys Fractional Laser. And once you come here and get a PRP treatment done, we also offer prescriptions who have 3 medication in one, and it's kind of like a hairspray. And it really helps to promote hair growth after the PRP and to maintain your growth that you have after you've done the series of treatments.
How should I prepare before my first treatment?
So before your treatment of PRP, very important that if you are taking a blood thinner and you're allowed to be off of it, we recommend at least 7 days prior treatments. You also want to avoid dyeing your hair at least a week before your treatment so your scalp is clean. We also ask you to wash your hair before coming to your appointment so everything is clean. Again, you can take Tylenol for pain, and afterwards just avoid putting anything on your hair, taking Advil or aspirin. You can take Tylenol.
So if I want this treatment, what should I do?
So if you want your treatment, the best thing to do is to come see us for a consultation. We'll be able to assess your medical history, but also to see at what level of hair loss you're at. If you're somebody who's bald, it wouldn't work, but if you're just starting to lose some hair or starting to thin out, then it's a great time to come see us and we can help your hair regrowth